You're supposed to kiss me.
Oh. Extreme facial fractures, psychiatric episodes, and enough trauma activations to keep an emergency department busy for days. Because you asked for it, your wish is my command. Today, we're breaking down and reacting to some of the most shocking medical scenes and red-soaked injuries from the new horror film Obsession.
Don't do that!
Let's dive right in. Bullous lesions on her chin. Looks like pockets of fluid on the chin itself. And it's a very specific area. So when we actually look at the face and we say, okay, there are lesions on someone's face, you think, okay, could it be a herpetic lesion like herpes simplex 1? Could it be impetigo? Could it be maybe erysipelas, but that would mostly just be red?
I'm disgusting.
Did you have a seizure or something? What happened?
Seizure, people will lose function of their bowels and their bladder, meaning that they may pee themselves or they may have a bowel movement. We also see people who lose control of those functions also when they go into cardiac arrest, sometimes when they pass out, but not that often. Often seizures also will include tongue biting as well, so somebody will have bruising or cut to their tongue.
I ate a bug, or I have stomach bug, I think.
She thinks maybe she ate a bug or had a stomach bug. Stomach bug meaning usually a virus.
A virus.
Causes GI tract issues where somebody will have nausea, vomiting, and diarrhea with some abdominal cramping. Sometimes you can have a bacterial infection. We'll test stool for that at the hospital.
I'll go shower.
Yeah.
And I'll clean it up. I promise.
You can.
Broken down material with chunks. When somebody has diarrhea per se, usually it's just watery. People say like peeing out your butt. I always tell patients in a weird, gross way, just take a photo so you can show us what you're talking about and then you can just delete it later. Just don't post it anywhere. We do like stool samples, but here would be difficult. It's contaminated by whatever's on the floor as well, so it won't be beneficial.
Did you cook the cat?
Oh my gosh, did you cook the cat? That's very sad. Caused her to have some sort of GI issues, maybe. If you're eating meats that you're not used to, or something's undercooked, or you didn't prepare something properly, it can mess with your GI tract.
Nikki, you can't do that. I am very upset about that.
The only cat stuff that I end up seeing at the hospital
Get that cat out of here.
is related to people getting scratched or bitten and the infections relating to it. And you have to be careful with cats, not because necessarily you're getting cat scratch fever, but you're also worried about other bacteria that they have to where they can puncture into your tissue.
Any other takers?
Whoa, what was that? Acting normal, then all of a sudden potentially hallucinates for some reason or has an event. And this could happen because of her obsession. She's not sleeping, not allowing her brain to rest. What ends up happening over a period of time, there can be confusion and events like this. Oh, laceration to the forehead and to the cheek itself. They actually did a good job. If somebody comes to the emergency department relating to this, there could be a head injury protocol that we're going to follow. You may need to do some imaging. There are major blood vessels just above the eyebrow, and that's why it's bleeding a lot up top. And there are some on the cheek, but not as many. What you want to do is direct pressure with not significant amount of gauze. Oh, if somebody comes in like this who has self-injuries, me as a doctor can put her on what's called either a psychiatric emergency hold, or I could put this individual on a 24-hour ED hold. Sometimes we have pills if somebody's feeling paranoid or having an acute psychosis.
No, you gotta clear. Get her to the hospital.
I'm so sorry.
Excited delirium or mania can actually cause the brain to ignore physical trauma and pain. It could be like a muted pain pathway or a gate theory pathway. You're getting all the sensory input, and then what's happening is you're causing yourself significant pain, and the pain is actually muted because it then allows you to focus on the other aspects of what you're trying to focus on. Maybe because he feels so bad in the situation that he created that he's disassociating with the effects. Sometimes as a medical practitioner, we see such really bad things that we don't disassociate, but we're able to turn that component of ourselves kind of down a little bit.
Perhaps you should deactivate your emotion chip for now.
So we can handle the tough situations, but in general, usually everything bounces back and we do have to handle it in our own time.
You're supposed to kiss me.
Oh! Able to break a window. It is hard to break a window. Increased risk of getting glass shattered into her eyes or any scrapes on her body. Sometimes glass wounds are a pain in the butt, literally.
Literally?
People come to the emergency department, same thing. They have big chunks of glass stuck in their body and don't realize how big it is. Basically, it's an inert piece of material. Our bodies are not necessarily getting infected by that. It could be because of open wound, but the body is trying to get it out like a splinter, so it's going to try to reject it. Oh! Whoa. Wow. Taking a brick to your head. Really bad. The face will break down. Fractured nose, fractured sinuses, fractured frontal bone, and so all this starts to cave in. When you have a fracture to your mid-face here, we call those Lefort fractures, and there's different degrees of them depending on which bones are actually fractured and how deep they go. When somebody gets so much trauma here, it can break the bone so badly, going into the brain tissue. Frontal lobe of your brain can now be open, exposed, bleeding, bruising to the brain. You can lose consciousness. You can also have airway compromise with all the blood that's pulling into your posterior pharynx. So there's a lot of things going on. So the question ends up being, in this scenario, could you potentially die or, succumb to your injuries relating to your head injury and facial trauma? Yes, if there's enough trauma and injury to this area. Whoa. You can make out an outline that there's a ton of missing tissue to a face, but there's no significant respiratory effort here. So you would assume that this individual has succumbed to the injury, but you're gonna look, listen, feel, because even if the face is totally disfigured and destroyed, somebody can still have an airway. They could still be breathing.
I'm so sorry you had to see that, baby. But it is kind of your fault.
Sometimes it's easier to find an airway in this scenario because you're just seeing a bubble. If you need to put an advanced airway in, like a tube into the airway, then you end up basically trying to lift the epiglottis out of the way. If you can see where the bubble is coming from, suction and put the ET tube through the vocal cords in that area because the neck is still intact. What the? Smoking a cigarette, people use nicotine as a stimulant, sometimes using for energy, sometimes using for focus. That potentially is why she's doing this, to help try to focus, to override the nervous system of this psychosis that she is in. Obviously not good because smoke into your lungs causes cancer. We know this. There's not a benefit of smoking. It's always a detrimental thing to your body. We see a lot of people who do self-injurious behavior due to stress, anxiety, lack of sleep, and overwhelm, too much neurosensory input. The physical harm actually focuses it, which is not good. That is not a good coping mechanism. Single gunshot wound to the head, hitting his right hemisphere. A lot of people are dominant to the right hemisphere, depending on right hand, left hand dominant. This single shot could take somebody's life, could also just cause severe head trauma, bleeding in the head, destruction of the tissue, could bounce a different direction, you don't know. I've seen patients come in with one gunshot wound, not survive, and I've seen somebody taking 10 bullets and survive without any issues. It all depends on placement and, unfortunately, the caliber and the scenario of which you're under.
Rip my eyes out of my skull and shove the barrel of my
Oh my gosh, vomiting on somebody else's face. When I worked in the ambulance as an EMT, I was almost like a sympathetic vomiter. Then one day I got vomited on. Not as bad as this. And then that sensation just disappeared. Now at the hospital, all you hear is people vomiting and having nausea and retching. So you have to get used to the sound, unfortunately. Ooh. This could cause chemical conjunctivitis in the eye, cause irritation to the eye, maybe an increased risk of infection. Stomach contents are acidic. pH is closer to like 2 to 3, so it can burn and can irritate your tissue, just like it irritates your throat when you vomit.
I love you! I love you!
I knew you did.
My heart is beating quick in that scenario. That was intense. She's bleeding on him. You think about the risk of infection or transmitting disease to another individual. When that blood gets in a mucous membrane, it does increase the risk of transmission of bloodborne pathogens such as HIV, hepatitis B and C. Those are the big ones that we think about. Oh my gosh, that was so intense. This movie is a good reminder that sleep isn't just about feeling rested. It's one of the most important things your brain does. That's exactly one of the reasons I created Do Not Disturb by my company Life Happens, to help support relaxation and healthy sleep when your mind just won't shut off. Check it out at lifehappens.com or on Amazon.
If space is what we need, then take it.
If anybody is ever feeling this way, there are hotlines, there are ways to get help. There are emergency doctors like myself. There's emergency psychiatric facilities, literally a phone call away, an app away. So you're not alone. There are resources. People are there to help you.
It's gonna be okay.
Overdoses that we worry about at the hospital, sometimes over-the-counter ones are really bad. Aspirin, Tylenol are very bad. Prescription medications, opiates, benzodiazepines. There are other ones that cause cardiac arrhythmias. There are others that also cause anticholinergic effects that can mess with your system. So there are a lot of medications that we get concerned about. Foaming at the mouth, hard to know what that's coming from. Is this frothy sputum coming up? Does he have pulmonary edema from what he took? He's having reflux. He's sedated. He's altered. Maybe his heart rate has slowed down or his respiratory drive has slowed down. So it all depends. If somebody's foaming at the mouth in this scenario, call 911. Don't try to wipe it all away or stick your hands in somebody's mouth because they can bite your finger off. They can potentially get there ASAP, give respirations, because typically when it comes to foaming at the mouth, it is a respiratory issue. A lot of times we do have reversal agents if you're able to get to the hospital sooner than later. A lot of times people will take medications that they shouldn't in a moment of stress, but then regret it shortly after. Please get to the hospital ASAP. We can help you. You can also call Poison Control. Poison Control in the United States is 1-800-222-1222, and they will help you immediately. No questions asked. Let me know if any of you have seen this movie. This is very intense. And as always, do me a favor, check out this playlist right here. Binge watch everything. And please make sure you subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.